I'm Delanne Elliott Midland, and I am the co-founder of the End Brain Cancer Initiative. So thank you for joining us today for the End Brain Cancer Initiative's Caregivers, Self-Care, and Tools webinar. And this is our series number 2 this year. Today's webinar is focused on financial toxicity with the idea of how do you escape financial toxicity with a oncology or a neuro-oncology diagnosis. We're going to move on today and hear from Jennifer Natola. And Jennifer is going to talk to us about essentially Insurance 101 and resources for out-of-pocket expenses. And so we are thrilled to have Jennifer joining us today. Let me tell you a little bit about her. She's a seasoned and strategic leader in revenue cycle operations with nearly 2 decades of experience in healthcare finance across the life sciences sector. Her career has been defined by a hands-on, people-first approach, building and guiding high-performing teams that not only optimize revenue, but also operate with purpose and empathy. Empathy, we need that. Thank you. Her passion for oncology reimbursement runs deep. She is committed to ensuring that every action taken, whether by herself or her team, contributes to the best possible experience for patients and their caregivers. Jennifer has always taught her teams to view each claim as a patient, not just a transaction. This mindset drives her work and reinforces the human impact behind every decision. With a deep understanding of payer dynamics and insurance navigation, she helps organizations overcome reimbursement challenges and accelerates resolution paths. She looks forward to bringing her expertise to the End Brain Cancer Initiative, offering support, guidance, and practical solutions to patients and caregivers facing insurance denials, ensuring they receive the care and attention they so deserve. Welcome, Jennifer.
Thank you. I'm so excited to be here.
We're excited to have you.
Great. So I'll just start with Amy did a fabulous job covering really how to ask for help. I will talk a little bit about some resources, but Amy did an amazing job, and I don't want to take away from anything that she shared because it was so good. So I think we can just go ahead and get right into it then. So, one of the things to think about when you're thinking about out of pocket expenses, I don't think a lot of people get an opportunity to be taught about what their insurance actually is. We don't always fully understand what's health insurance, what's life insurance, what's home, car, boat. Like, we just don't understand the details around insurance. So, it's important to try to understand your policy. And I know that that might seem overwhelming, but you can always ask for help. And that is something that I will be here to help and support with the End Brain Cancer Initiative. But if you have questions, you can talk to your employer if you're getting insurance through them, if you're going through an insurance broker. And most importantly, call your insurance and ask them to explain your coverage to you. Help use them to help you have a better understanding as well. That is what they're there for. And the most important thing is just because you have insurance, it does not mean that everything is covered. You pay for your insurance, but you're paying a portion, and then you're signing up essentially into this contract that you will pay X, Y, and Z on top of your premium for this coverage. So it's really important to understand where and how you might have limitations within your insurance. And one of those can be that sometimes certain prescriptions, procedures, or different types of treatments require a prior authorization. And what that is your insurance company ultimately stating that they believe this treatment is medically necessary, but that is not a guarantee of payment either. So understanding that you might have to secure a prior authorization, but it should never be you securing it. It should be the healthcare provider who wants to provide you that treatment. So again, talk to the doctor, talk to the facility, whoever it is, and Maybe they might need you to fill out a form or something, but you should not have to secure the prior authorization. And then just really the most important thing, if I could stress anything, is making sure that you understand what providers and facilities are within your network and your insurance, and you do not see out-of-network providers. That is one of the biggest, I think, scary challenges that could come up is your out-of-network benefits are more expensive than your in-network. So again, you are paying for X amount of coverage, and if you see in-network providers, you will pay less. If you see out-of-network providers, that is how they get you, and you will have to pay more. There are certain ways to navigate around some of that, depending on your plan or what you might be asking for. Sometimes you can get in-network exceptions, but really trying to make sure that you are seeing in-network providers and going to in-network facilities will make the difference in the long run. And then thinking about your managing your strategic costs, kind of just covered that, making sure you use the network providers. But you can always also ask, is there a generic medication? When you get your bills from all of the different places, ask them for itemized. Sometimes their statements aren't clear and they aren't itemized, and that is okay to ask for what you need. There's no better advocate than yourself in most of these situations. And then payment plans are so critical. Do not be afraid to ask for one. And they might push you into something. We need you to pay $250 a month. Pay what you can pay. As long as you're making payments, you're going to keep your account in good standing. But people don't want to tell you that. So, like, you just have to remember that paying something is better than paying nothing. And that's what keeps your account in a good standing. And talk to them about it. They wanna get that bill paid too. They're going to work with you. So don't be afraid to ask for that help. And then financial assistance resources. So Amy is a financial assistance resource through and through. And what she does at a hospital is exactly what I would advise. Like, seek out a hospital financial counselor. Again, ask for that help. I know it's really challenging, and Amy touched on this, to ask for help first and foremost, but that is okay. You need to do that. You cannot do this alone. So asking for the support that you need is really going to be critical. And navigating, how do you do this? What are the nonprofits that you might be able to ask for help for? What are the copay assistance programs and the government programs? Yeah, it's overwhelming and confusing, and I don't even know how to navigate them all successfully. So the more people that you can ask for help, the better you will be. But there are people that are the subject matter experts in these arenas, and they will help you and they will do it compassionately, which is also really important. And then, really, when I think about like tips for caregivers, keep all of your records. I know for me, for example, I'll get this thick envelope. I have United Healthcare for my insurance, and inside's like 25 pages, and it says on it, this is not a bill. That is correct. That is your explanation of benefits. This is your insurance company telling you how your benefits have been applied. Save that. And then as you get your invoices from doctors or facilities or anything else, look at it and compare. Are they billing me the same way my insurance company said my benefits were applied? And that is like your first like check and balance if you think about it. And then if something does not seem right, and even though, let's say it's a hospital that's sending you a bill, you can call your insurance and say, I received this bill. Can you help me understand? And then in some cases, your insurance company might even call on your behalf to the hospital to say, you're incorrectly balance billing my patient, or whatever the situation might be. So don't be afraid to start with your insurance company. They know your benefits best. Yeah.
Jennifer, can you explain bounce billing?
Sure. When your insurance company processes a claim, they use certain codes, and those codes will dictate if there's a patient balance or not. And there's a lot of like the No Surprise Billing Act and different things out there where facilities aren't actually able to bill you for that balance. And in some cases, that could inadvertently slipped through the system. There could be a problem on their end with their system. There could have been an oversight by a person who's keying it. So that's why it's important to ask on that, because again, that explanation of benefits you get from your insurance has shown you what you should be paid for. And if you're getting something different, then you were incorrectly billed. So making sure that you are just aware of those two matching up.
Thank you.
Yep. And then again, stressing a lot of what Amy said as well. Like, there are support groups out there that can help you navigate this, and sometimes maybe even be able to do this on your behalf. And then really, it comes down to at the end being able to ask for help and being able to seek out those resources so you're not alone as you go through this process. So, one of the resources that I have stumbled across that I thought would be valuable to talk about here is the Mission for Maureen. And why I really like this is because this is $1,500 that can be used for anything. So, it does not have to just be your medical bills, it could be your rent, your mortgage, utilities, car payments, anything like that. And when you fill out this application, you'd actually send them a copy of your bill. So, you could send them your car payment, and if you're approved, they're going to pay it directly for you, which then alleviates that burden as well, because you could have the best intention of, I need this financial assistance, and then you get it. And then all of a sudden another bill came up. And it's like, which one's the most important? But if you know that you're earmarking something, you could then even call your car company, your loan company for your car and say, hey, I'm working on getting this paid. Could you allow me some time, whatever that conversation looks like. Again, it's the same thing. Don't be afraid to talk about this and ask for the help that you need. So I think that this is something that's important to think about is, and Amy covered this, life continues on. Our bills do not go away. So how do we figure out getting the support that we need? And that's by researching some of these, and ultimately you would know best based off the requirements when you start to look at these applications. Of course, there's always going to be a financial aspect to it, so depending on your income or things like that, that will heavily factor into it. And then you can see in this one I called out, the completed application form, a pathology report, a photo of yourself, and 3 copies of your bills that you need help with. And then there's always a processing time. And I will tell you, from what I've learned, December seems to be a difficult month, I think, for people with applications. It's the holidays, it's the end of the year. Do they have the funds? So December seems to be a little bit challenging, but I think no matter what, you apply anyways. And think about it as like, okay, I'm going to block 4 hours on a Saturday and I'm going to apply to, these 4 grants that I might be able to get assistance with. And most of them will need a lot of the same information. So, you could get approved for all 4, you could get approved for 1, but it doesn't hurt to try. Musella Foundation is another great one. So this is up to 5,000 in financial assistance per applicant. And this is used though solely for the cost of your drugs for your treatment. So there are some requirements in regards to what are you being treated for? What type of drug are you being prescribed? Again, the same, you have to think about your income requirements. And of course, there's no repayment. I did not specifically see anyone say a repayment is required, but they called this out so intensely on their page. I wanted to make sure that I put this here as well. But they have other resources as well. Again, like the online support groups, chat rooms, newsletters. This is where you can connect with somebody else going through the exact same thing that you're going through, and you can, make connections that could be really impactful for you. All right, there is a lot on this slide, so I wanted to squeeze this all in, but this is all of the additional resources as well that I have come across. And National Brain Tumor Society is fabulous. If you have not checked out their page, I encourage you to do so. Both the National Brain Tumor Society and American Brain Tumor Association have lists of programs that you can really look into. So I focused on American Brain Tumor Association, and I've captured a couple of them, but you can see that they have, again, even programs around like the travel and the lodging, which can be really important. We don't all live within a 30-minute drive to the facility we want to be treated at. We want to see the best doctors. That could be a 2.5 hour drive, and you might need to spend the night somewhere. So why not ask for assistance with that? And I can even tell you that I live on the East Coast, and when I take my mom to Dana-Farber, you get your parking reimbursed, you can get discounts at hotels. You just got to talk to your facility as well, and you're able to get additional help that you might not have even known was available. So I did call out a few of them, which is Help Hope Live, Kim's Hope for Glioblastoma, the Pan Foundation Glioblastoma Fund, and then the Darren Dalton Foundation. So these were four that definitely stood out when looking at this. Their phone numbers are provided. And I do believe that everyone will have access to this resource. So you will be able to go ahead and pick up a phone if you want. I know sometimes searching online can feel overwhelming as well. And you just want to talk to someone and not have to figure it out yourself. So I wanted to make sure to provide the phone numbers for everyone too.
Thank you.
This is Insurance 101. So, just to give a little insight here. So, I know that we've talked a lot about premiums, but I just want to make sure that everyone understands that insurance is not free. And we do have to pay for it. And the thing about it is, this is what keeps your health insurance active. So, if you work for an employer, this is the amount that's taken out of your paycheck every week, biweekly, monthly, however it is that you are paid. And so the best way to describe it is you are paying into this, whether you go to the doctor or not. This is guaranteed. This keeps your coverage active. So when you do need it, it's there and ready for you. And then next would be deductible. So thinking about your premium, all right, that's set in stone. I know I'm paying this. When you choose your benefits, so again, when you're looking at, what is it that I want to pay? What can I afford to pay? The deductible is the amount of money that you're going to have to really pay out of pocket before your health insurance really starts to cover care for you. And the number one thing to think of with that is the lower your deductible, the higher your premium in most cases. And the lower your premium, the higher, it goes vice versa. So thinking about if you have a deductible that's $1,000 and it's January and your plan just started over, and you haven't contributed to that deductible at all, you're probably going to receive a bill for that full $1,000. And I know that I've had plans in my life where my deductible was 3,000. And so it's really making sure that, do you have the ability to cover that? And how might you cover that if you have your deductible? So really starting to think about that when you're choosing your plans. And sometimes, again, if you're going through your employer, you have FSAs or HSAs or something like that that you could contribute funds to. But this is where, if you don't have that, thinking about where do you get some of these supplemental insurances, a secondary insurance, or how do you apply for copay assistance or financial aid through your facility. The next one is copay. And so copay, I think most people are probably familiar with. That's when you go to your doctor, you go to registration, you're checking in. They typically ask to see your driver's license. They ask to see a copy of your card, and then they say, your copay is $30. How would you like to pay for that today? And that is a standard requirement for most physician office visits, except for preventative care. So like your annual physical or something like that might not have that copay. And your copays will be different on your plan for specialists. So remember that as well when you start to see physical therapists or different types of specialties, that a copay can increase. It's not always the same. And your copay, a lot, you're probably familiar as well around your prescription cost. So when you go to your pharmacy, but the different tiers of medicines in your policy, you'll see one set copay could be 10, one's 20, one's 30. And based off of the type of medicine that you're getting, the different copays would be applied. And then coinsurance. I think coinsurance is the sneaky one that I don't think people always gets, because you know you have a deductible, you know you have to meet that, you know you have a copay, everyone's familiar with paying that. But then coinsurance is the bill that you get in the mail later. And it always surprises me. And I know that it can surprise other people. So essentially, this is a percentage that is going to be your responsibility until you've met your deductible, until you've met your out of pocket. So a lot of plans have a 20% coinsurance. Some could have a 30% coinsurance. I don't see too many too different. A 10% coinsurance is beautiful. But when you think about that, again, I have a little example in here. So you get a medical bill for $1,000, you owe 200, your insurance paid 800 because your deductible has been met. So that is your 20%. So you might have gone to the doctor's office, paid your $30 copay, and then you're getting this $200 bill and you're like, but I paid $30 when I was there. Why am I getting this? It's because you have a coinsurance part of your policy and you ultimately have an out of pocket that needs to be satisfied. So if we want to jump to the next slide, we can talk about out of pockets. This is the thing, though, that I do enjoy, because I know that I've had years where I've met my out of pocket maximums and then everything's covered. And that is like, you have a golden ticket to healthcare for the rest of the year. So sometimes that can be really nice, but you have then had to pay a lot upfront to meet that. So it's a double-edged sword. So think about this, where your out of pocket maximum is typically large. 5,000, 6,000, that is going to include your deductible. So if your out of pocket max is 6,000 and your deductible's 3,000, and then that means you have to pay an additional 3,000 between copays and coinsurance. And once this is met, you will not receive another bill. You will not pay for a prescription. You will not have to pay a copay when you go into the office. You will, however, still have to pay your premium, because remember, that is your guaranteed must pay to keep your insurance active. But you're out of pocket when you're looking at your insurance benefits. If you can find a low out of pocket maximum, that is always going to be the better plan, because that will ultimately mean that is how much I'm going to pay out of my pocket. And the most important thing that I can stress on this is you will have an out of pocket for in network and an out of pocket for out of network. So you have to be mindful of that. Again, when you're thinking about who am I seeing, you want to see an in network doctor. The reason why is your insurance company has essentially created a contract with a group of physicians, a group of hospitals, and they have guaranteed that they will pay them a better rate because of this contract, this agreement that's with them. And therefore, they know they're going to get more business because people in the area that have this insurance are going to go to this hospital. And when you start to be serviced at an out of network, you will be charged more. And sometimes what can be really super sneaky is your lab work. This is one of the things I think that surprises the most people is you go to an in-network provider. And when you're at that in-network provider, they then take your lab work and send it off somewhere else or tell you to go somewhere else. And that place might not be part of your network. And so just making sure to do that due diligence as well. And I think that's the most important piece is if they're telling you to go somewhere or they send your stuff, ask those questions. Yes.
Amy, so what if you do ask those questions, such as where is my blood work going? And it turns out it is out of network. What do you do then?
So it can be tricky. So if they've already sent it, I think the challenge is then finding out from them, okay, so based off of my coverage, they won't pay for this because it's out of network and maybe there's no payment at all. And then it could be a conversation with that lab directly. I didn't know that my blood work was being sent to you. If I had known, I wouldn't have agreed to this. I think the other thing is just making sure that you have that conversation. And a lot of labs are in hospitals now. And so sometimes, like, you could go to the off-site labs like a Quest or some other places. There can be certain call outs in policies that don't allow those types of labs to be used. So again, it's reading your benefits up front and definitely knowing that. I would encourage everyone at the beginning of every new policy year to make sure that you are aware. But if not, upon a diagnosis, I know that can be overwhelming, but that's where you can reach out and ask for help. And, it's something that even I would offer to help you with is, looking at your policy information with you just to make sure you have everything clear and understood. And they typically send you packets of information, or you can get them online and you can dig into the details that way.
Jen will probably cover it at towards the end, but she is available to help people understand their insurance policy and including all of the things she's talking about
Yep.
and strategy too, right? And
Yes.
so she's available now through the End Brain Cancer Initiative. And thank you so much. I know
Yeah.
you're going to be helping a lot of people.
I look forward to it. And then we covered this essentially already, but an explanation of benefits and EOB. Again, that will be what you get in the mail. It will say this is not a bill. It'll have your insurance company logo on it. I cannot stress enough to save that. And additionally, save all of your bills.
Hmm.
I'm not a tax expert. I'll never pretend to be, but that might be something at the end of the year you might want to talk with an accountant on. Like, do you itemize like all of your medical bills from the year? There are definitely things that could benefit you from that as well. So making sure that I would grab a file folder, even an accordion folder, something like that, and just start saving everything. I know nobody likes to get stuff in the mail anymore, but I never, when it comes to health related stuff, will never sign up for electronic statements because of that reason alone. I want to get paper copies. I want to be able to review my stuff. If it comes in an email, then I have to print it. It's a hassle on my end. Let them print it. It does not cost them anything. And that way you can get it in the mail and you can save it for your records. It's much easier than you having to do it yourself through your email.
Thank you.
You're welcome. So that is it on my end. I don't know if there's any questions from anyone. If not,
Okay, let's see. I'm looking, I don't see it yet. So anyone who has questions, please either unmute yourself and ask the question or throw your question, type it in the chat. Elise, can you go back to Jen's title page, which is her contact page, and just have it up while we talk just for a little bit so people know how to get a hold of her? It's Jennifer at endbraincancer.org.
Mhm.
That would be awesome. So that would be really, really great. I am I'm kind of laughing a little bit, Jen, because I'm like, oh, sorry. I hate insurance policies.
I know.
Okay. Okay. They're cringeworthy. I'm just going to be honest. That's my take on them. And I will be honest, I'm not sure I've ever read my entire insurance policy ever.
Yeah.
Um, I wish they would write them differently, one, so
Mhm.
they're just super layman terms,
Yeah.
man, and cut out all the stuff. But I'm sure there's legal reasons why they write them the way that they write them. I thought it was really great. You were talking about, of course, in pocket.
Mhm.
So something happens. I'm at my healthcare provider. They say, okay, I want to send you for a special, like you were talking about, either a special test or I want to send you to a specialist.
Mhm.
So it is the responsibility of the patient or their caregiver, family member, whatever, to ensure that whoever you're being sent to, whatever person, company, healthcare provider, lab is in your
So
policies network, correct?
it does depend. So an example would be is if you're being sent to another facility for, let's say, an MRI. Typically, those might require a prior authorization, and so there's going to be someone at the facility that would verify your benefits, and they would help with that piece. But it also depends on your plan as well. And I did not get into HMOs, PPOs, EPOs, anything like that. But if you have a PPO, you can choose who you go to without a referral. And therefore, that's where it can become a little dangerous, because you could do some research online, find someone, say you really want to see them, but without checking that they're in your network. That's where you could have a problem. If you have an HMO plan, you are going to be more restricted, because they won't let you just go ahead and reach out to someone without that referral from the doctor who's sending you there, which means more likely than not, you will end up with an in-network facility or provider. So that's the other piece of your plans that you kind of got to understand, is what type of plan do you have, because some have stricter rules on how you go about seeking coverage and have made it so you won't get blindsided, and others give you more ownership, which can be really nice. But then it is up to you to make sure that you're doing that due diligence. Yeah.
What does PPO stand for?
Oh, man, of course you're going to ask me that. Hold on. So it's like I know what all of this stuff means on the back of my head, but I don't always know.
I forget
Preferred,
too.
yeah, preferred provider organization.
Thank you.
Thank you.
And then the HMO, hospital, is it managed?
I believe it is. I'm just double checking. It is health maintenance organization is what it
Okay.
is. Yep.
Thank you.
Yep.
Thank you. Okay. So I guess I'm not seeing any questions, which means you
I have
didn't.
a question, Jen, for you.
Great.
Sure.
What's the difference between medical deductible and member out-of-pocket maximum? So,
Yep. Yep. So your deductible is going to be what needs to be satisfied first before your
okay.
insurance pays anything. So at the beginning of the year, everything really gets applied to your deductible, especially if your plan runs on a calendar year. So you go to the doctors in January, you're going to get a bill. And your out of pocket max is what throughout the course of the year, your insurance thinks you're going to have to pay, which could be that $5,000, and your deductible's 2,000. So after the 2,000, your coinsurance kicks in for that last 3,000 amount that gets you to that $5,000 out of pocket max. So deductible fully your responsibility, and then coinsurance is typically 20% of each cost, which then all goes towards that out of pocket max.
Okay. Thank you.
I hope I explained that well. I know it can seem foreign, if you're not living in it. Yeah.
So Jen, thinking about our patient population that we serve, and we are always saying that they should get a second opinion.
Mm.
So from an insurance perspective, how does that actually work? You know,
So
we
I
don't.
Yeah, so this is what I would suggest. I know that everybody's at different stages of being technologically savvy. But what I can say is a lot of insurances have spent a lot of time and money on making their apps really user friendly, and sometimes even more user friendly than their websites. And there's a feature probably on every single one of your insurance apps that says find a provider. And so if you were going to seek a second opinion, you could type into that, a neurosurgeon or whatever it is that you might be looking for, and they're going to show you your in-network options first. And they might only show you your in-network options. So that is a good tool. And if not, the website. And then if not, you could always pick up the phone and call your
Absolutely.
insurance too. Hmm.
Absolutely. Yeah. This is a personal thing. I was seeking a second opinion, and I was kind of shocked at the sticker shock, the
Yeah.
the dollars that were required for my second opinion. I'm like, oh, I thought I was entitled to that. You know. from an insurance perspective, health insurance perspective.
Yeah. And again, I think that might just be tied to specific plans, like what, yeah, what is covered, who you're seeing, how it's coming about. Yep.
Yeah, and I will say I have seen more and more restrictions within health insurance policies for second opinions, right?
Mhm.
But what I have seen is a expansion on telehealth
Yes.
second opinion. So that means, they've already been given access to your health insurance records, your procedures, all of this,
Hmm.
and they're spending time reviewing them, and then they will meet with you depending on. This is the other thing with healthcare providers related to telehealth.
Hmm.
There are some rules related to different states and going out of state for different, but
Absolutely. Yep.
but having said that, in the brain cancer space, we can help you with access to different specialists, even if they're out of whatever state that you're located in. So there are ways to do that. If if
Mhm.
the if the health if the provider and who they work for hasn't invested in their specific licenses that you have to get for each state, et cetera,
Yep.
to provide the ability to talk to patients outside of the state where the physician
Yep.
practices or the state where the patient resides. But there
Hmm.
are some ways to get around that too, just so you know, everyone. So just let us help you,
Hmm.
please. That kind of thing. So that'd be great.
That's a good point that you brought up. Absolutely. Yeah. There can be challenges, but you can navigate them. Yep.
You can navigate them. And we're lucky enough as an organization that's been doing this for over 23 years that we're able to call upon these specialists and, on behalf of patients, kind of argue their case, so to
Mhm.
speak, so that they do get a second opinion. So this is really, really great. Thank you, Jen, so very, very much. Really
You're welcome.
appreciate it.